It is common in endodontic specialty practice to have patients referred for care. These patients usually have excellent quality dentistry, excellent oral hygiene, excellent periodontal and gingival tissue. Occlusion is perfect. However, when we obtain a radiograph to diagnose the case, we find a totally different situation. Here we have a very aggressive periapical pathology has invaded the bone, dissolved the bone, creating pathology, and resolved the root. In this situation, lesions could be small, large, and even reach critical size. We also receive patients who received endodontic treatment before, and has the teeth been accessed and treated, and they still failing. And here we look at the situation, we have almost access preparation on every tooth that's been previously prosthodontically treated. In this situation, used to be a clinical observation among us endodontists throughout the years, 80s, 90s, 2000s. Now it is a scientific fact since the 1990s. Now we know that 13 to 20% after crown preparation and placement within 4 to 7 years, we have an endodontic pathology. 2 years after veneering. In situation we have pulp capping, mechanical pulp exposures in this situation. 40% within 5 years will develop pathology. And if it is caries exposure, it's in the 60 and 70% within 5 years. This is the research done by Dr. Huwaisat in Jordan. Other references tell us that after 10 years, only 10% of the pulp caps, they're going to survive. But the number which astonished me is the last one. 20 to 64% of substandard, poor endodontic treatment within 5 to 10 years and perhaps more will develop pathology. This is important because this is astonishing because if you do not have endodontic treatment, if you have just pulp pathology and you develop AP, the percentage is no more than 1.5 to 5%. And with this situation, you have external endodontic root resorption, manifesting about 25% of the cases clinically, but histologically, it's there, 100%. Every time you have AP, you will have resorption. The number which is astronomical for me is this one, that regardless of the endodontic treatment material, as long as you have a substandard technique, you're going to have failure. And you're going to have failures in big percentages, 24 to 64%. Globally, it's 52%. These cases also receive posting. And many times the post destroys the root canal treatment. And now we have more problems because these dentists, after the endodontic treatment, they wanted to strengthen the teeth with fictitious posting procedures, and you see something happen like this. Now, this is the endodontic problem after prosthodontics. This is the situation that we discuss in our series, the Abu Ras Endodontic Masterclass series coming up soon. Thank you for listening.